Welcome to the video portion of the Pacific University College of Optometry CE course on neuroocular vestibular dysfunction, otherwise known as NOVD or sometimes called C6 syndrome. What we're going to do today is to try to demonstrate a typical NOVD patient. We'll take a case history and we will go through training procedures and what is done at vision therapy progress reports and demonstrate it all to you. Our patient today is Nora Chan. She is a third-year optometry school student here at Pacific, and she has a mild or moderate degree of motion sickness, is not an NOVD patient, but we'll be working through that. I am Dr. Rod Gillilan. I'm a retired optometrist from Eugene, Oregon. I've been working with NOVD patients for 35 years. All right, to start with the case history. And NOVD can be diagnosed basically by taking a case history only. So it's very, very important. In your manual, you'll find a list of questions that can be used as a guide on what it says, how to make a tentative diagnosis of NOVD. I don't actually use this in my office, but I think it would be a good guide for you probably to start out with. So I'm going to just read the questions to Nora, and then you can see how you might be able to start out on your own with this. Number one question is, can you read in a car without headache, dizziness, or nausea?
Actually not for very long, maybe 2 to 8 minutes, and I feel nauseated.
Okay. Is that the only symptom you have, just nausea, or what else happens?
Actually, I also get very sleepy, and I think that's just like a safety mechanism.
Okay, I think maybe you're right. After I have done a diagnosis, I demonstrate to the patient. Normally we'd be sitting in a chair, an exam chair, but for the purposes of this filming, we're standing. Take a handheld Morrison ball, hold it in front of the patient's eyes, and have the patient look at it for just very briefly, because they're going to be very, very sensitive to it. But I would do it like this, look at a letter, and usually that's all it takes. And the reason I do this, I know what the reaction is going to be before I do it, but I want the patient to be aware that the symptoms will come when they're sitting in a chair. They're not in a movie, they're not in a car, they're not on the ocean, they're not doing any of these things, but the symptoms will come by just moving their eyes alone. And Nora, did you feel anything at all when we do this?
Yeah, actually I did feel a little bit like the world was spinning just a little bit.
The world is spinning a little bit.
Mm-hmm.
How would you feel if you did this, if you had to do this for a couple of minutes? What do you think?
Not too good. Dizzy, probably get dizzy.
Okay.
And I feel myself moving a little bit.
Yes, I can see you
Yeah.
wobbling a little bit. And this is another good thing, because you want to be careful not to make the patient sick. So I often would say, well, I would stop, but say, how would you feel if you had to do this a little bit longer? So in that way, and the patient's usually going to tell you, they'll usually know. There are only a couple ways that we can measure progress with numbers, rather than just symptoms. And this is one of them, called a Saccadic tester. Hold that up to your nose. It's made with a coat hanger and a couple of beads. And I'm going to have you look over here, Nora, and I'm going to time you. When I say ready, begin, I want you to look back and forth as fast as you can from one bead to the other. We're going to do this for 10 seconds. I'll say begin when ready, begin.
Okay.
Okay, good. There was 20 times that you went back and forth. Most patients will improve about 100%, so I hope hopefully by the end of your training that you will be quite a bit faster than that. We'll now do a far and air test, do the same thing.
Okay.
Why don't you look at, let's have you actually look at this bead
Okay.
and then the camera, and I'll time you again just like we did before.
Okay.
Starting here.
Okay.
Ready, begin. Okay, that's 20 again. And how did that make you feel?
Again, I felt a little, like what you called motion within me.
Okay.
So.
Was your eyes are a little red, a little teary right now?
Yeah.
And your face is a little flushed?
Yeah.
I can see it. So it really did affect you. Even though Nora is very mild in her sensitivity to visual motion, you can see visually now. I can see it, and you can feel it.
Yeah, I can feel it.
Right. I'm sorry we did that, but it was an excellent demonstration of that. I'd like to demonstrate a method of testing for dynamic vision acuity. This is using a Meyerson ball hung from the ceiling. Many NOVD patients could not really do this. Some could. Those that can, it's again another way of measuring something to put numbers on it so patients can see improvement from week to week. So the patient would stand directly under the ball, and I'm going to swing it around Nora's head and ask her how many letters she can see on the ball. All right?
Okay.
I want you to keep your head still
Okay.
and just move your eyes only. Ready?
Okay. 2, 9, 2.
Okay. Good. All right. Now, after you're through with your training, I would expect you to be able to do considerably better than that, maybe 3 or 4 or 5. At this point, after the diagnosis is made, then it's important that I try to explain to the patient what condition they have, and they're usually happy to know that there is a name for what they have. They've gone from doctor to doctor to doctor searching for answers. Or if they haven't gone to doctors where they have been ashamed to go to doctors because they tell them these symptoms and the doctor thinks they're crazy, they are often relieved to know that, again, that there is a name for it and that there is, more importantly, that there is a cure for about at least 80% of the patients that do the therapy. In your manual, you have a paper on NOVD and its cure, and it explains in about 3 or 4 pages what the condition is. At this point, I would give this paper to Nora and have her take it home and read it and show it to her family so she has people at home that understand the condition as well. All right, we're now at the point where Nora has gone home, or the patient has gone home, they've talked it over with their family, they've discussed everything and decided to go ahead with the therapy. And it's very important to bring a family member, if at all possible, at least in this first vision therapy session. In my office, we did all home training, but in many offices, they do office training, so the situation might be a little different. Nora has brought her pre-therapy goals, and in writing. That's very, very important to do this because patients kind of forget after 2 or 3 weeks what their original goals were. So I'd like to have you tell us at this point, Nora, what are your goals?
Be able to ride in a car without motion sickness. The second one is to ride an airplane without having to take Dramamine each time.
Okay, thank you. I think those are probably all achievable goals. Most NOVD patients in the forum pre-therapy goals list also would be checking off most of the check-off boxes listing all of the symptoms. I want you to bring this back each time that we see you. 2 basic pieces of equipment, and they're very simple.
Okay.
The first is a couple of pencils. These have the alphabet pencils where they have letters on each. They don't have to have letters on each of them, but if you do have those, it's kind of handy. All right? These can be in any sequence, but we'll start out with number 1, which is looking at a letter in this pencil and this one. Alternate from one to the other. So you're holding your far away pencil steady and then moving gradually, going far and near and far and near and far and near. And the other 4 is going from side to side, looking from letter right and left, right and left. When you've started feeling uncomfortable, then just stop and start over again.
Okay.
So you go this this way. And as you get a little bit better, you can start going at different angles.
Okay.
And different angles. And different angles, alternating. And different angles. All right? And now there are 2 exercises with one pencil.
Okay.
One is called a push-up. And you go as close as you can to your eyes without feeling too much discomfort, and then start over again. And then when you get a little more comfortable with that, you can come at different angles.
Okay.
And this way. Okay. There's one other exercise with the pencil. Are you okay?
Mm-hmm.
And look at the pencil and look up at the camera and look alternately from the pencil to the camera, back and forth. When it gets difficult, then stop and start over again. All right, now you can control the degree of difficulty with this by how long you do it, how quickly your eyes move, and how close the pencil gets.
Okay.
So if you're feeling like it's too difficult at first, then slow down, take more breaks. Don't separate the pencils quite as far. The farther apart they are, the harder it is.
Mm-hmm.
So kind of keep them close together to start out, and then gradually increase that.
Okay.
Also, if you feel more comfortable in the beginning, you can do this sitting.
Okay.
And that might be easier for you, because when you're first starting out, you might start feeling a little weary, a little wavy, a little discomfort. So it's probably best to start sitting, but after you get more intuitive, after a few days, then you can do it standing.
Okay.
And then there's a recording sheet that I will give you. I want you every day to make it in the daily log to record what you're doing. So when you come back and for your vision therapy progress report, then we can see exactly what you've been doing. All right, now we're going to demonstrate the Mars and ball techniques. And Nora, there are, as you can see, numbers on this ball. Sometimes there's letters. The reason for that is that it gives you a small target to look at, and it tells you, then you are aware when you're focusing on it properly or not. So if the letter is blurred, it means you're not tracking properly. We'll be swinging this in various directions, and there are at least three, maybe 4 ways you can control the degree of difficulty. One is how close you stand. The closer you stand to the ball as it swings, the harder it is. And by the way, I never want you to stand closer than arm's length.
Okay.
And number 2, how long you do it, the harder it is. And then the swing, and how far the swing is. So 3 things: how long you do it, how close you stand, and how far great the swing is. So there are, I think, 4 different swings we do. We start out with this one. You hold the ball, go ahead and hold on to it, and just release it, let it go. Okay. Looking at the number as you do that. Do you feel okay?
Mm-hmm.
All right. So this one should not be too difficult, because your eyes are just turning in and out and not having to go sideways.
Mm-hmm.
All right. As you get better at this, as you be more comfortable with it, then you can stand back a little bit and swing it farther. Another one is going side to side.
Okay.
Ready?
Mm-hmm.
Can you track the letter?
Mm-hmm.
All right. How do you feel?
Okay.
All right. Now you need to find the point at which you think if you went a little bit longer, a little bit wider, that you'd start feeling a little nausea maybe. I want you to get right up to that point, but not beyond it.
Mm-hmm.
So again, you can, when that happens, you can slow this, not swing it quite as far, or stand back a little bit. Some people that have NOVD, we couldn't begin to do this. At that rate at least. Maybe we would swing it just maybe 6 inches, and they would be standing possibly 10, 12, 13 feet away. And they can only watch it for 3 or 4 seconds. And then we start over again. In that case, they'd have to have a partner helping them with it. The most severe also, as Nora is standing here, but NOVD patients often have to have something to hang on to, because when they start watching this, they might lose their balance. So they could possibly do it sitting down to start. The most severe NOVD patients have to lie on the floor and watch it swinging over their head, because then they have full body support. They're not going to fall, and they have less dizziness. And now we go circular. How do you feel doing that?
It's okay. So.
All right. So as you do that, then we go greater swing. And the last one, and they don't have to be done in this particular sequence, is go ahead and hold on to the ball and just release it, let it go. A diagonal swing. And then you do it one way and then the other. Okay, how do you feel?
This one was more difficult.
Yes, it's more difficult because you have to turn your eyes more. So to start out with that one, you want to maybe stand back a little bit, maybe 3 or 4 or 5 feet, and don't swing it quite so far, and then baby up on it a little bit. Try to gradually get closer and closer and closer. By the way, also you can start either the pencils or the ball first. It doesn't make any difference which you do. You can alternate if you wish. You can do the ball for a while and the pencils for a while. So they want you to do that actually about 18 minutes a day, and this 10 or 12 minutes a day.
Okay.
One more thing is that as you go, you should start out with the ball slightly below your eye level, and then as you get better at it, feel like that working okay, then go up higher. It's harder to do up higher.
Oh, okay.
So I want you to start at the easiest point and then go up higher. This ball has a little device, a little circular plastic button with 2 holes drilled in it that makes it a nice device to be able to move it up and down like so. So you're going to be taking a ball like this home and hang it in a prominent place, some place where you'll have lots of space around it. So because later on you'll be walking around the ball and you'll need a little more space. One of the ways that you can tell whether you're in the proper training zone or not is how you feel after the training session. If after 15, 20, or 30 minutes after the session, if you're still not feeling very well, you're probably overtraining. So the next session you need to back off a little bit. Also, I want you to do the training all in one session if you can. But it's too difficult, then you can split it up into two or three sessions each day, mini sessions instead of one long one. There are some NOVD patients, when they first train, they're so anxious, they're so excited about doing it, they tend to overtrain. If you overtrain and you make yourself sick, you have to stop training for about 3 days before your body comes back to the point where you can start again. So be careful about that. Report to me in the next day, in a couple of days, by phone, and call me anytime. Then we'll make an appointment now for you to come back after you've done your therapy, and we'll see how you're doing. Go from there. All right, at this point, we have demonstrated the beginning therapy exercises, both with the ball and pencil. Normally, the patient would have done these exercises for about a week. Then we come back to the office for a vision therapy report. In this case, that logistically didn't work out, so I'm going to demonstrate the intermediate exercises. At this point, so we'll have to take it kind of easy on her because it'll be a little beyond what we normally would be doing. And I should mention also that the goal for your beginning exercises was to be able to do all of the things that I demonstrated to you without any symptoms. So when you can do all of those exercises symptom-free, then you're ready to go to the next step, which is what we're going to do right now. Okay. So before you were stationary and the ball was moving.
Right.
Now everything's going to be moving. You're going to be moving too.
Okay.
So I want you to put your feet further apart.
Okay.
And rock back and forth, and just look at the end of the room over here
Okay.
with the cameras. And everything okay? All right. Now I'm going to put the ball in place.
Okay.
And look at the ball and continue doing the same thing. And what do you see? How do things look? Do things look any different when you're looking at the ball and not?
Yeah, definitely. I mean, you notice the periphery more, and I noticed the movement more.
Yes, okay, so she's seeing the motion, the parallax, the motion, more sensitive to that. You're going to do all of the same exercises you did with the ball before, all but the one coming close to you, but you'll be in constant motion.
Okay.
So, for instance, with this, back and forth, go the opposite direction of the ball. Okay, so you're moving, the ball's moving, and the room looks like it's moving, right? So it's much more difficult, much more difficult.
Right.
Again, you're not, she is not quite ready to go to the intermediate step, but in demonstration only. So do the same thing here, just kind of keep rocking laterally. All right, and with the diagonal swing. Now this time come forward. Put one foot in front of the other. And I'll help you here. There we go. Face me a little bit more. Yes, okay. And then you do it on the other side. So you do the same procedures that way. Now we're going to add some things. And this is much more difficult. It's much higher level. Okay. I will demonstrate it to you so so it won't make you sick. Watching the ball. Now the room is going to look like it's spinning, even though it's really not. And when you get so that you can do that comfortably, then you start moving the ball in a circle. And walking with your shoulder to the ball a little bit and looking at the number. When you feel like you're getting a little dizzy, then turn and go around the other way. When you get dizzy, turning, going the other way kind of unwinds you, and it usually will reduce the dizziness. All right? That's one exercise. There's one more that you do, and I won't ask you to do it, but I'll demonstrate it to you.
Okay.
You stand direct into the ball and swing it around your head. And looking at a letter as it goes by. If you get to the point where that is easy and there's no symptoms and it's easy, then you can start moving and turning. All right, now most people think there's no way I could possibly do this, but you'll be surprised that you will develop the ability to do that very slowly and very gradually. Now we're going to demonstrate the intermediate alphabet pencil exercises. She will be doing exactly the same things with her eyes, but she's going to be doing different things with her body. Okay. Right? So I want you to do all of the same exercises and just walk slowly in a straight line. And we're a little confined to the space here, so we won't go very far. But just go 5 feet or so and turn around and come back. Slowly turn around and come back.
Okay.
Okay, and then you turn around and come back. Now do the side-to-side one maybe. All right. So when you get home in your living room, if you have a larger space than this, hopefully, you'll be able to walk a greater, maybe in the hallway or something. So you walk in a straight line slowly at first, doing all of the same exercises. Now your eyes are going to slow down. Your eyes are not going to be able to go as fast when you're walking. It's hard to do two things at once. So when you can do all of that comfortably, and there's no nausea, dizziness, or headache, then you can start walking in a big, slow, lazy circle, in the largest circle that you can in your home. So go ahead and do that now. Just any of the exercises, and just go in the The bigger the circle, and the slower you go, and the slower your eyes go, the easier it is. So your goal, if there are no symptoms and it's too easy, then you need to walk a little faster, make your eyes go a little faster, do it a little longer, and make the circle a little smaller. You try to find the proper training level. Okay. Your goal at the end of all of this, when you're through the advanced stage, is to be able to stand in one place and do all of your pencil exercises just spinning around.
Okay.
Now, it is impossible for you now, but it
Mhm.
won't be by the time you're through. And remember that if you start feeling a little dizzy, when you're walking in a circle, to turn and go the other way.
All right.
And take rest periods as you need.
Okay.
And remember to record your progress in the daily log. Call me in 2 days. Call me anytime. We'll set up a time for you to come back. And I think you're going to do great. Here we are again at the first vision therapy progress report. Before I talk to Nora, I'd like to tell you about something that I neglected to say earlier, and that is there are some people that are what I call delayed reactors. In other words, some NOVD patients who, when I swing the ball, most patients, when I swing the ball in front of them, are going to react immediately. These people that are delayed reactors do not react at all, which always surprises me. But then that same person will tell me later at the next visit that after they got home, maybe half an hour later or whatever it is, then they developed the symptoms of motion sick, of the nausea, the headache, the dizziness, and it was sometimes quite severe. Because we tend to overdo it a little bit when I'm trying to see if there are symptoms and nothing happens. So I do it a little longer than I normally would. So anyway, so that does happen, and with that particular patient, when you train them, when you first start the training, you need to be a little bit careful. Normally, we back off of training when the patient develops symptoms. In this case, there aren't any until too late, and so you start out at a very, very low level and then gradually build up as you go. All right, enough of that. Let's talk to Nora now. It's been 2 weeks, Nora, since you started your therapy.
That's right.
And tell me, how many days did you do the training?
I did it for 9 days total.
Okay, and how many days in beginning, and how many days in intermediate?
5 days for the beginning series and 4 days for the intermediate.
Tell me what happened then. How did it go?
When I first started at the beginning, I did it for a couple of days, and I did it in the morning. Then I noticed that I would actually be tired because I would try to read, for a test, and I wouldn't be able to because I was too tired, and I just go to sleep. So then I switched it to the evenings, and by the 5th day of the beginning, I was feeling great. I didn't have any symptoms, so I felt like I was...
You didn't have the fatigue?
No, so I felt like I was ready to move on to the intermediate. And intermediate, same thing in the beginning. It was more difficult, more effort to perform the therapy. And now I've noticed that it's not as hard, but I still have the symptoms.
Okay. Did you have any other symptoms besides fatigue?
No, it was mostly
No
fatigue,
nausea,
not nausea, but a little dizziness with the intermediate series.
Okay, and other than the training, were there any changes in symptoms?
Actually, yes. I noticed that I've been able to ride in my friends' cars when they actually drive manual, and usually as a passenger in a manual car, I do have some signs of motion sickness. Well, I've noticed that 3 times already, I had no symptoms at all.
Three different times you did?
3 different times, yes.
Wow.
I had no symptoms at all. And actually, just a couple of days ago, I was in my friend's car, and we had a test the next day, so I was actually reading in the car. And surprisingly, 30 minutes went by, and I had no symptoms. And the only reason why I stopped was because it was getting too dark for me to read.
And was the driver surprised about that?
Definitely. I mean, she knows how I am, and so she figured that I'd be done in 2 to 8 minutes, like how I usually am, and I wasn't. I couldn't read because it was dark.
That's very impressive, and that's a sign that you're definitely improving.
Thank you.
That's good news. Between takes, Nora asked a good question about the use of the small handheld ball versus the one hanging from the ceiling. And I'd like to answer that now. I'd like to have this little handheld ball chair side. It's real handy for one thing. It also moves faster and will elicit symptoms more quickly and more instantly, I think, sometimes, than the one overhead. So that's why I like to use this. And right now, I'm going to just have Nora watch this ball. We normally don't test this way, but just to see what her reaction is compared to what it was 2 weeks ago. So, how do you feel?
Okay. Feeling a little bit, but not not too bad. And the letters, I can actually follow one letter pretty clearly too.
Okay. All right. So your face still looks okay this time, not like last time. All right, let's go ahead and do the testing with Saccadic tester now.
Okay.
I'll say ready, begin, and then we'll go for 10 seconds.
Okay.
I'll tell you when to stop. Start here. Ready, begin. Fifteen, 30, okay?
Okay.
Pretty good. Last time you were
20.
20, all right? So that's 50% improvement already. And how do you feel?
Oh, a little bit.
Feel a little
Yeah, I
bit.
can feel a little
Okay,
bit.
okay. So there's two things with the testing. One is the numbers, and the other is how they feel, whether they're symptom-free or not. Obviously, the Saccadics are faster and easier now, but Nora is still not totally symptom-free. All right, look here,
Okay.
and then up there, and ready, begin. Okay, 22. And how do you feel now?
Same thing, just
Okay.
a little bit.
I can see you
Yeah.
reacting to that a little bit.
Yeah.
The second one.
Yeah.
Why don't we test your dynamic visual acuity and see
Okay.
how you're doing with that? Can you see any letters now?
Yes, I see 2, 3, 2, 3 this time.
Terrific. Okay. Now, I didn't tell you this before, and I didn't tell the doctors this either, that in the beginning series, some people find it just difficult to do, and so they turn it's easier if they kind of follow it with their nose around at first. I'm going to have you do that so you can just kind of demonstrate that. So come closer. And this time, turn your head as it goes around.
Okay, definitely I saw a lot more, almost like a whole side of a ball.
Mhm. So it's much easier to track the letters this way.
Definitely when I'm following.
So if people need to do that to start, that's okay. And try to minimize the head motion as they develop. It's important that you have the patient demonstrate how they did the procedure at home. Sometimes my instructions weren't adequate, or they didn't quite understand it, and they might have done it incorrectly, and it's important to know that. So I'm going to ask Nora now to demonstrate what she did at home with her basic beginning Morrison ball techniques.
Okay. For the basic beginning, I let the ball go, and I basically kept my eye on one of the numbers, and I just went back and forth like this, and I did the same thing but sideways.
Was one angle more difficult than the other?
The most difficult angle was the one where I did it from diagonally,
Okay.
and I would let it go from here. This was the hardest one because once it got out to here, it was really hard
Yeah,
for me
sure,
to see it.
Sure.
And then I did the same thing here.
Your eyes have to turn farther, and of course the ball is closer.
Mm-hmm.
That makes sense. What about the height? How did you raise it then after you first started?
Yeah, exactly. This is actually kind of low for me right now because by the end of the beginning series, I was all the way up here.
Okay, good. All right, that's with the beginning. Now show me what you did with the intermediate Mars and ball exercises.
Okay, so with the intermediate, I basically did the same thing. I let it rock from about here, and then I swayed, keeping my eye on, actually I could keep my eye on about 3 of those numbers there.
Okay.
And then I did the same thing this way, swaying forward, and I just went against it, or tried to go against it.
Mm-hmm. It's hard to get started.
Yeah. And then I also, with the intermediate, I also swung it around, and then I just followed it in a circle.
Mm-hmm.
And the most difficult one was where I had to swing it around me. And then I follow it also again with
Okay.
with my eyes here.
Okay, now Nora, I'd like to have you demonstrate what you did with the pencils, first with the beginning series and then with the intermediate series. So go ahead and show me now.
Okay, so with the beginning, I started the pencils about this far, and there's the letters on the pencils. I prefer to actually use the one side with a Z and the other side with an A, so it's easier to tell when I was looking at what, and I just went back and forth. And then as I progressed, I just started moving it and just kept watching it. I also did it this way, and then I did it this way too.
Okay.
And then I did the near far, and then near far while moving it in and out.
Mm-hmm.
And
Excellent.
then also I raised it to make it a little bit more difficult.
Mm-hmm. Okay, that's what you did with the beginning series.
Right.
And then go ahead and show me the intermediate.
Okay, so the intermediate, I went ahead and I just started about here, and I just walked in a straight line, and then turned around, or I keep running for this one. Same thing, I did it like this. And then I would turn around for here. And I actually also started doing it where I spun around slowly.
Okay, go ahead and show.
Okay.
Okay, good. Now I want you to tell me, after you've done the intermediate, did you feel like you were making any progress? I'm going to let you look at your graph here and your symptoms and how long it took you to recover from it. And do you think, did it get any easier? What happened? Tell me about it.
In the beginning, the very first 2 days, I felt like it was a medium effort. Then the next couple of days, just a little effort to keep it going. And by the 5th day, I actually felt like it wasn't too bad, and I felt like I was ready to move on, so that I moved on to the intermediate series.
Right, then tell me about, with the intermediate series, then what were your symptoms? And
Intermediate series, same thing. First couple of days were more difficult. It got a little easier. I'm still in the intermediate because I'm not as comfortable still with it.
Okay.
Yeah.
Terrific. And thank you for filling out your report forms, your log, in both parts, the daily log and then the overall evaluation log graph. Looking at it, you started with a -1 the first 3 days, went up to 0, up to 1, and back to 0, and then up to 2 for 2 days, and then up to 3. You ended up with the 3 being 1 out of 10, with 10 being the best. This is something that doctors that I like to use, have the patient bring them with them at each visit, because I don't have to go through all the notes. I can just at a glance see what's happening. Also, it's important for the patient to be able to look at this, and sometimes they kind of forget what they were like, especially if it goes several weeks, maybe 3, 4, or 5 weeks. They kind of forget what their symptoms were when they started. So they can look at this too, and it's encouraging to see when I started out here down at a 0 or a -1, and it's ending up at a 7 or 8. By the end, we want it, of course, to be a 10 all the way across. And when it flattens out, then we know we're there. At this point, we'll go ahead and instruct you on advanced procedures, even though you're not really ready for that.
Right.
And I know that you have to be symptom-free with
Right.
intermediate, so I would normally not give you this instruction until you're ready.
Okay.
So I want you to continue with the intermediate until you feel comfortable, until you're totally symptom-free, until you can do it without any fatigue, without any discomfort whatsoever. When you're ready to do that, then you're ready to go to advanced. So let's go ahead and start in with the advanced instruction. Normally, I demonstrate each procedure to the patient and then have them demonstrate to me how they're doing it, and so I can correct them if necessary. In this case, I'm going ahead and demonstrate to you, but I'm not going to have Nora do this because she's not quite ready for the advanced stage yet. With advanced pencil exercises, we can start out by walking in a circle, actually without pencils to begin with, and try to see how tight the circle can be. The ultimate goal with this is just to stand in one place and turn, when the patient gets a little bit dizzy, turn and go the other way, and end up being able to spin and without any symptoms of nausea, headache, or fatigue. A little dizziness is okay, but they should be able to cover within 2 or 3 or 4 seconds. So that's one part of it. The other part is with the pencils. Again, this time the patient will be looking at the erasers, not the letters, and doing the same eye exercises, but moving in a circle again. Starting slow, but going faster and faster. All of the same exercises. And again, the ultimate goal is to be able to stand in one place and do all of the 4 procedures with the pencils. Doing them up high is harder. When the patient can do those things without symptoms, they are bulletproof. They should not have any symptoms that they had previously. Nora asked how long she should be training each day, and she should be training about the same amount of time that she was when she started with the beginning series, which was about a half an hour. Some patients, when they start, will have to break it up into tiny segments, maybe 2 or 3 minutes at a time. Being more mild, she could do more at a time, and that's the best way to end up, if you can, if the patients can, is to have the training be done in one session rather than split sessions. So she's doing about a half an hour. She should continue with that with the advanced series. And some people take longer than that, maybe 40, 45 minutes, but probably not more than that. All right, I'll demonstrate the advanced with the Marson ball. It's really not much different than what it was previously, except you just do it more intensely, swinging the ball around the head this time, and turning again inside, and turning as quickly as you can comfortably do it, going one way, then going the other. This way, of course, you can see the letters easily, this way. This way, you're going so fast you really can't see letters. But attempt to do it, but you're really only going to see 1 or 2 letters maybe. Then after it's done at eye level, the same thing is done above eye level, which is more difficult. That's all you do with the Marson ball. Then there are things that the patients can do on their own when they're not during their official training period, and this is true anytime during the training period, not just the advanced. To be able to walk in circles, just walking in the house. If you do this out on the street, people might think you're a little weird, but in the house, when you're walking down the hall, just making circles as you go down the hall. It's interesting how you can improve your equilibrium and sense of balance by doing this. And this is a lifelong process. So that's all we need to do for today. And we'll see Nora when she's ready to be evaluated after the advanced procedures. Here we are again. Nora has completed her training, and let's find out what happened. Nora, tell me a little bit about it. How long has it been since you discontinued your formal daily training?
About 3 weeks.
Okay. And you've been doing a little bit of training since then?
Yes, here and there.
Just occasional?
Occasional,
all right. And let's review. I think the best thing to do here might be for you to review the pre-therapy goals that you wrote down. Tell me what they were, to remind us what they were.
All right. They were to be able to read in a car without being nauseous, to be able to ride an airplane without having to take Dramamine, and to be able to ride as a passenger in a car and never having motion sickness again.
Okay. So, let's just start with number 1. What about reading in a car? Have you tried that?
Yes, I have, and I am able to read in a car without feeling nauseous or the main fear of it. I feel like I've come over it.
Mm-hmm. Have you tried that more than once, reading in a car?
Yes, I have.
Several times?
Mm-hmm.
And what happened?
The first couple of times it was, I was anticipating, the motion sickness,
Mm-hmm.
and when it didn't come, very surprising, and of course I was happy about it. And now I don't have that anticipation because I kind of know, so I don't have that fear anymore, which is great too.
That's nice. No anxiety.
Right, exactly.
Okay, good.
The second one was to be able to ride an airplane without taking Dramamine. I was able to ride go on a 2-hour flight plane and not have to take any Dramamine, and I was just fine. I went on a 5-hour flight back home, and I was still a little worried.
Where is home?
Oh, back in Hawaii. And I was still a little worried, so I took a half a pill of Dramamine, which usually I didn't need to take one, and it was just because it was anxiety. I felt like I needed it. I was still a little too scared, and I felt fine, and I wasn't drowsy, which I normally am after taking Dramamine, and so it was
That's nice.
great. Yeah.
So when you got off the plane, you could function.
Yeah, exactly.
Okay. So have you flown at all without taking anything?
Only the 2-hour flight
The
that
2 hour. The 2 hour.
Yeah, because I haven't had that many opportunities to fly though.
Right,
But
right. Well, that's exciting. Good. And what was the third one?
And the third one was to be able to ride as a passenger and never have motion sickness. In general, I haven't had any motion sickness. There have been a few times that I have had it, and I think it was more the situation in which there's a lot of stop and go, and when the person's driving manual, that was the only time, and that was only like a few occasions, but otherwise in general,
You can tell the difference there.
Yes.
Okay. Sounds good. Sounds good.
As you remember, at each therapy report, I have the patient demonstrate the latest techniques that they've been using. So Nora, I want you to do that now. Show me what you've been doing with the ball.
Okay.
I'll stand right over here. There we go.
Okay, so first I basically spun myself around, watching the ball the same direction and actually have all targets and
Okay.
visible.
All right.
And then I did it in the opposite direction. And then without the ball, I also spun in place too, and basically as fast as I could. For the pencils, basically the same thing, the pencils with the letters. I first did fixation or rusticates and back and forth, and walking about this big of a circle, going back and forth between the letters. I also did this same thing, spinning in place. And then eventually I brought it diagonally and also near far too. And then if I got dizzy, then I went the other way. And also the same thing, spinning, and also just with one pencil. And I did the push-ups. The letter A. And I just keep this in focus, bring it in. And then did the same thing near far target. So I had it about right here. And the same thing.
Wow.
And that was it.
That's very impressive. Also, at each of ETPR, I like to do testing, things that we can put a number on. And we'll first test the dynamic acuity. And right here.
Okay.
Ready?
Mhm.
How many letters can you see now?
I'd say 5, almost the whole side of the
Wow.
ball.
Wow.
3 there. 3 again. 3 or 4. Nothing there. The whole side almost.
Wow. Okay. Terrific. Excellent. Okay, I'll put that aside. And let's do saccadic testing now.
Okay.
Pull that up to your nose. Are we lined up okay? Look over here. I say begin. Roll for 10 seconds. Ready? Begin. Okay. 15 as I counted. Which 15 complete cycles, so that's 30 altogether.
Okay.
So that's quite an improvement. You started with 20,
Mhm.
major improvement. Can you tell any difference in your ability to do that?
Yeah, I mean, I can feel a difference already. I mean,
Mhm.
it's a lot easier for me to do it.
Okay, let's go it this way now. Go forward in here. Starting here, looking at that.
Okay.
Can we go over there? Ready, begin. Okay, 28. And the initial testing was 20, so that's quite an improvement. I like to do a handheld Mars and ball as well, because I can observe the eye movements a little more easily. Okay, you ready?
Mhm.
Nice. Very nice. And let's go this way. Looks nice and smooth. Okay, Nora, you've completed your therapy and done all of the testing. Are you glad that you did it? Tell me about it.
Definitely, it's been a wonderful experience. Now I can look forward to everyday activities without that anxiety or fear of, you know, performing those tasks that I used to, or, you know, going on an airplane without having to, you know, make sure that I do have Dramamine on me. You know, I know that now, hey, if it's a 2-hour flight, I can do without it, and I'll be fine.
That's pretty exciting.
Mhm.
You may be just flying around all the time now.
Yeah.
Okay. Do you think that you'll be using this in your practice when you get into practice yourself?
Oh, most definitely. I mean, especially with my own hands-on experience, and my symptoms are a lot more mild than any of the NOVD patients, and so at least I can relate even on the most mildest terms, and even with such mild symptoms, I was able to, you know, overcome it with an easy therapy. I don't see why, you know, anybody else should have to go without a cure or treatment for it.
Terrific. You've been an excellent patient. It's been wonderful working with you, and congratulations.
Thank you.
I would like to introduce the third member of our team, Hong Wen, who is usually on the other side of the camera, so now you get to be in front of the camera. I would also encourage you doctors to provide this therapy for your patients. It is very, very exciting for us to be doing this, and it will be for you. You will be making dramatic changes in people's lives, and people will be grateful to you forever. If you have, as you're doing this, if you have any questions, any comments, we would encourage you to contact us individually at our homes or through Pacific University. It's been a pleasure. Thank you very much.